Antepartal care is the routine care that all healthy women can expect to receive during their pregnancy, ensuring the overall health of newborns and their mothers and helping to reduce the low birth weight babies born each year.
Ma'am, maayong buntag. Ako si Faye. Magpapresent ng mga informasyon. Isa pangalan, ma'am. Pilay mong edad, ma'am. Saan mo birthday? Saan mo release, ma'am? Saan mo trabaho ka? Saan mo mga
The purpose of blood pressure is to obtain a baseline measure of arterial blood pressure for subsequent evaluation. We need to assess the patient in signs and symptoms of hypertension or hypotension, and also assess for any allergy on the latex. The first procedure we have to do is to do hand washing. This is to kill the bacteria in our hands. Then, we have to introduce ourselves to the client, identify the client, and explain what is the purposes behind the blood pressure taking. Then, we begin to inflate the cuff. Once the pressure in the cuff is above the subject's systolic pressure, blood cannot flow below the cuff. You will hear no sound in the brachial artery when you listen with the stethoscope. As you release the pressure valve and slowly deflate the cuff, blood begins to flow through artery. When the pressure in the cuff is between the systolic and diastolic pressure, you can hear a tapping sound with each pulse. The first tapping sound you hear indicates the blood has entered the artery. Record this reading as a systolic pressure. You continue to deflate the cuff until the tapping sound ceases. The last tapping sound you hear indicates the diastolic pressure. After that, we have to explain to the client the results of the blood pressure and give them health teachings.
Take the temperature. First, wipe or dip the probe with alcohol. Second, wipe the axilla dry by gently patting it with a dry, soft cloth. Third, push the on-off button. Place the probe into the armpit and keep the arm firmly against the body side. Wait for the beep. Take the thermometer and read the temperature. Switch off the thermometer. And lastly, wipe the thermometer and return it to storage area. Position the client comfortably. Place 2 or 3 fingertips on the client's radial artery and press gently. Rest your thumb on the back of the client's wrist. Count the pulsation for 1 full minute. After pulse taking, do not remove your fingers on the client's wrist and count the client's respiration by observing and noting the rise and fall of the client's chest for 1 full minute.
Ma'am, kalakaroon, ma'am, kay yun na mo ang imong height, ma'am, ha? Sandit lang sila lang, ma'am.
Ma'am, karon ko ano tayo kabugaton, straight lang ka ma'am, ay pagtungo.
First maneuver. Facing the woman, the examiner places both hands flat on the abdomen of the woman to determine if fetal head or breech is in the fundus. Head feels hard and round, freely movable and ballotable. breech feels large, nodular, and softer. Next, the examiner palpates the superior surface of the fundus and determines the consistency, shape, and mobility. Second maneuver. Still facing the woman, the examiner places the palmar surface of each of her hands on either side of the abdomen. Then, the examiner palpates the sides of the uterus by holding the left hand stationary to determine the position of the fetal extremities, the fetal back, and anterior shoulder. Third maneuver. Still facing the woman, the examiner gently grasps the lower portion of the abdomen just above the symphysis pubis between the thumb and index finger. Then, the examiner determines any movement and whether the part is firm or soft. This is to determine the position of the fetus that is presenting and if engagement has occurred to confirm the first maneuver fixed in the pelvis. It is 90% if head is in the inlet or in the pelvis of the woman. Fourth maneuver. The examiner turns and faces the woman's feet. Then, the examiner places fingers on both sides of the uterus approximately 2 inches above inguinal ligaments and presses downward and inward in the direction of the birth canal. This is to confirm the findings of the third maneuver to determine the flexion of the vertex. The cephalic prominence is felt on the sides where there is greater resistance to the descent of the fingers into the pelvis.
Fundal height. Search for the fundus of the mother and then get a tape measure. Set the 0 point on the pubic bone and measure it up to the fundus.
Note location, rate, and character. As an internal rotation and descent occur, the location of the fetal heart tone changes, swimming gradually from the right or left quadrant to the midline and dropping until stat before delivery, when it is above the pelvic bone. Determine the position, presentation, and RLE of the fetus by palpation. Place the stethoscope on the abdomen over the back or chest of the fetus, depending which is closer to the uterine exit. Listen and count the beat for 1 full minute. To detect slowing or irregularities, normal rate is 120 to 160 beats per minute. Avoid friction noises caused by fingers on abdominal area.
Try push away. Stand a couple of feet away from a wall with your hands in front of your shoulder. Place hands on the wall and lean forward. Bend your elbows as your body lean into the wall. Keep heels flat on the floor, then slowly push away from the wall and straighten. Push away 20 times and repeat this 10 times. This exercise improves the circulation of your legs, which should make you more comfortable later in pregnancy.
Tailor sitting. Sit on the floor, put your feet together, place one leg in front of the other. Lock inward towards the perineum and gently push knees with hands downward towards the floor until she feels her perineum stretch. This is to strengthen and stretch inner thigh muscles, to relax and tone up buttock muscles, pelvic floor, and uterus.
Shoulder circling. This is performed either standing or sitting. Keep back, head, and neck straight throughout the exercise and allow arms to hang loosely in the side. Slowly rotate the shoulder up and back in circular motion. Inhale as shoulders is rotated and exhale as the circle is completed. This helps strengthen back muscles.
Knee bending. Deep knee bending using a chair for stabilization, with feet slightly apart. Inhale when bending and exhale when standing. The rationale behind it is to help to stretch the muscles of the pelvic floor.
Lie on your back. Bring your knees close to your chest, applying slight pressure, then relax. This is to strengthen the thigh muscles for delivery.
Si Maila, yung student nurse karon. So, ma'am, karon buntaga natay pa nagstorya bahin sa imong pagbuntis. Kung unsa ba imong mga pagbati, unsa ba imong mga reklamo bahin sa imong pagbuntis. So, ma'am, unsa imong mga reklamo? Abaga o sakit imong abaga o imong hawak. So, kanang pagbuntis, ma'am, dili gina siya lalim nga butang. Kay, since naman tayo ginadala nga tao sa tutian and bugat gina siya, ma'am. So, para malikayan nato or maminusan ang kasakit sa imong abaga o sa imong likod, dapat mag-maintain taog maayo nga postura sa atong likod. So straight gina siya, ma'am, ha? Mag-straight gid ta para dili na magsakit atong likod o abaga. Sunod, ma'am, likayan nato ng mga sapatos nga kanap itong may mga tako nga tag-as sakit na siya, ma'am. Makasamot na siya sakit sa imong kwan o baka sakit pag gina sa imong tiil. So, likayan na sana nato siya, ma'am, mintas nga gabuntis na. Sunod, ma'am, is kung likayan lang nato nga mag-asa ta og mga bugat na butang. Dili lang sa, ma'am, kay gabuntis kaya ta, ma'am. So, likayan na nato. Kunya, ma'am, kung mag-asa magalit ta og mga butang, ma'am, dapat naasa sakto nga postura tong lawas ug ang atong tuhod atong i-bend kung mag-arsa ta, ma'am. Dayon mag-exercise po ta, ma'am, sa samaan ng mga shoulder circling kato among gitulo sa imo, tapos tiil-sipit kato ang imong tiil. Dayon maura to sa, ma'am. So para po sa mga uban pa nga pagahimoon, ma'am, kay dapat mag-stretch ka sa imong lawas, ma'am, or sakto lang nga pag-stretch, ma'am. Twist ano kayo para kaliyuksad magamit sa datong likod, dili kayo nga makabati kita og mga sakit. So maulang to siya, ma'am. So, ma'am, naaba ba kay lain nga reklamo or mga gusto ipang isulti bahin sa imong mga debate sa imong kuros? So, ma'am, kanang yun, kanang mag-kuros kita, kasagaran kuan gina nato kay siyempre bugat bayaan atong tiyan niya ang pressure sa atong tiil madulok. So para maminusan na siya or para malikayan na siya, ma'am, kay dapat ang atong tiil na sa sakto nga posisyon firme. So isaka po nato itong tiil gamay, iliyok-liyok nato ug dili lang po kita magsige og tindog nga dugay, ma'am. So mula to siya, ma'am. Unsa pa man imong lain nga mga concern bahin sa imong pagbuntis? Okay, so sakit ihi. So, ma'am, likayan lang kayo na nato ang mga parat nga pagkaon, ma'am, ha? Dili lang sa kita, binus-binusan lang sa nato, ma'am. Unya, napod ko itulo sa imo, ma'am, nga exercise. Ginatawag ni siya nga Kegels exercise. So, testingan ganinin mo ni siya, ma'am, kung ka na mangihi ka. Sa tunga sa imong pag-ihi, iundang dahil, ma'am, ihunong siya, tapos balik na pud kag ihi. Imo ni siya himon kada pag-ihi nimo. Bisan og dili ka mangihi, ma'am, mahimo din nimo siya. Kani siya nga exercise, ang kuan ani, purpose niya ani, or ang importansya niya ani kay para ma-exercise ang mga muscles sa imong kinatawo. So, muna siya exercise pag-contract, mag-relax, pa-exercise man na siya, og usapon nga importansya ani kay makatabang ni siya sa pagpadali nimo og pagpanganak para dili kay ka maglisod, ma'am, ba. Kay exercise naman imong muscles sa imong kinatawo, so dali na kay ka pag mag-utong ka,